The debate goes on, no doubt. A transgender woman accused of using cement and Fix-A-Flat to perform butt injections is now charged in the death of a former client. On Friday, a Florida judge set bond for O'Neill Ron Morris on manslaughter charges and practicing medicine without a license. Investigators say she's accused of injecting a toxic mix of Fix-A-Flat, cement, mineral oil and super glue into women's backsides. One woman who received the injection at least 10 times died earlier this year. But an attorney for Morris says there's no way to tell if the client died from the butt injections or other cosmetic surgeries that took place after receiving those injections. Police say Morris was part of an underground network seeking out people who can't afford to pay real doctors for cosmetic procedures. While the Fix-A-Flat case is extreme, let's be honest, it is extreme, experts say the threat of black market surgery is a real and growing problem. Here to talk about some of the risks is Dr. Anthony Youn, assistant professor at William Beaumont School of Medicine. Great to have you with us, Dr. Youn. Bring this home for our viewers, you know, the risks associated with cheap procedures.
Well, the risks basically start with death, and we go from there. And that's what happened in this unfortunate case where this person died. There's infection, there's bleeding, but you can die if you have bad plastic surgery.
Yeah, I mean, that's the bottom line. Even though this is an extreme case, as you say, you can work backwards and there are long-term effects that can come from this kind of thing. I mean, how can you tell the difference between a good deal and a cheap or potentially dangerous procedure? How can you tell that something is too good to be true, so to speak?
Yeah, I mean, if it sounds too good to be true, it probably is. And so basically look at the cost of the procedure. If the procedure is significantly cheaper than what you see advertised by everybody else, then there is a problem there. And also, where is it performed? You know, this person did not perform the procedures in a medical office or a hospital setting. It was performed typically in hotel rooms and back rooms. So a lot of this is common sense, but there's more to it than that, obviously.
Okay, so I want you to walk us through the 3 questions you believe that any potential patient must ask before, you know, going under the knife or agreeing to have surgery with an individual. Walk us through those step by step.
Yeah, the number one thing is make sure your surgeon is certified by the American Board of Plastic Surgery. Especially if you're having body surgery done, there's one type of surgeon you want to say board-certified plastic surgeon. www.plasticsurgery.org is a great resource for this. Second thing is you want to make sure your doctor has hospital privileges to perform the surgery. There's no law against any doctor performing any procedure they want to as long as it's done in their office. And so a lot of doctors will perform procedures that they're not trained for. Hospitals won't let that happen, though. They'll vet the doctors first. And so if you can perform it in a hospital, typically you're at least well-trained to do it. And then the third thing is how much time is that doctor spending with you? If the doctor doesn't spend much time with you in the consultation, you can be assured that during surgery that doctor may not be taking his or her time either.
All right, that's important stuff. Some really good information for our viewers there, things they should ask before undergoing any kind of surgery with a plastic surgeon. Dr. Anthony Youn, really appreciate you joining us tonight. Thank you.
Thank you, Aisha.
Well, it is top